All right, the Council of Governors has, for the better part of the day, been engaging the Ministry of Health. My colleague Abdi Aziz Hashim is with the team at the Nairobi Hotel. Abdi, good afternoon.
Good afternoon to you too. Indeed, Irene Muchuma there from our studios at Broadcasting House. It's all about the universal healthcare coverage. That's why for the better part of this particular morning, a high-level delegation of meetings between the national government, represented by the Ministry of Health, and the Council of Governors have been conversing about the various bills that were proposed during a cabinet meeting that was held in Kakamega by President William Ruto and a host of cabinet secretaries. Now, to recap some of those particular bills, it was all about the Primary Healthcare Bill of 2023, the Digital Health Bill, Facility Improvement Finance Bill, as well as the Social Health Insurance Bill as well. But something interesting that has just happened this particular morning, it has also been revealed that the Ministry of Health will be playing a critical part in the upcoming Mashujaa Day celebration set to be held in Kericho on the 20th of October. And joining me to explain more about what has just transpired this particular morning is none other than the Principal of Secretary of Health, that is Mary Muthoni. Katibu, welcome to KBC Channel 1. Maybe tell us, the first question will be to you, given that the Ministry will be playing a critical part in the Mashujaa Day celebration, what have you planned for us?
Thank you very much. As a ministry, we are very keen on primary health care and especially community health promoters who are going to be launched by His Excellency the President of the Republic of Kenya on the 20th of October, the Mashujaa Day. He's going to flag off 100,000 community health promoters. And this is going to be the onset of moving our health sector from curative to preventive and promotive. We want the community health promoters moving from household to household, ensuring that they are checking the health issues of the elderly and people in general at the bottom of the pyramid. Equally, it would be an educative matter, telling the masses on what type of food that they need to do. It is important to note that people live with small ailments that can be sorted at the bottom of the pyramid without necessarily going to hospital. And that is why we have the 100,000 community health promoters. They will walk around, they will take your BP, get to know whether you're well, your blood sugar, and any other common and minor ailments that are there in our communities. Not forgetting that the public health issues that come with waterborne and vector-borne diseases like cholera that we can prevent before they become a pandemic. Therefore, it is going to be a very good moment during Mashujaa Day, knowing very well that when we move from curative to preventive and promotive, it is the best way forward. And that is why even in one of the bills, we have the community health bill to basically just see how do we structure, how are we going to operate, because it's not an amorphous operation that we have started. It is an intergovernmental engagement between the national government and the county government. In fact, the stipend that will be given to these community health promoters will come from the national government, part of it, and the county government, part of it. So we are working very closely. And as you can see today, we are in the process of public participation for the bills, the social health bill, the digital bill, the community health bill, the primary health care bill, and the commodities bill. And this will in tandem help us to govern the issues around Ministry of Health. Thank you.
Given that we can see you're focusing on community health volunteers across the country, to the significance of even trying to change their name to community health promoters, maybe should we be seeing this as a move by the ministry to even add more in terms of ensuring there are more health workers at the devolved units, especially within the slum areas?
One of the key priorities at the Ministry of Health is the human resources for health. And this is part of the additional workforce that we may be having. Remember, these are no longer volunteers. That's why we are calling them promoters, because they are carrying the message to the people, to the masses, and telling them, hey, look, we can do better than we are doing. Instead of going to hospital, can we deal with this issue at home by eating well, by cleaning our spaces, ensuring that the public health space issues are taken care of, wash your hands, drink boiled water, ensure that they are cleaning places, the schools and hospitals are also clean to the level that they are supposed to be. And again, we will also be encouraging a lot of referral system moving forward, such that we do not have people who have minor ailments going to level 6 hospitals, which is Kenyatta, KU, to be treated maybe for flu. You need to go to a level whereby you're seen by the doctor who is concerned with that kind of ailment. We have done the assessment of levels for the whole country, a whole 15,000 health facilities across the country. That includes the public hospitals, the faith-based hospitals and clinics, and equally private hospitals. This is going to also help us in budgeting. And equally, it is going to inform us what type of hospitals, clinics, dispensaries are at a certain geographical area. Therefore, if we have around 100 households, what facilities do they have? What type of human resources in health they have? And what machines or even equipment in that facility are there? In a few weeks, in a few days, we will be giving you this report. And maybe at that time we can converse much better and see how much we are doing for the people of this country and by the people.
Maybe your final words. You have just heard from the Cabinet Secretary of Health, that is Susan Nakumbicha, that she would like to see even governors during that particular Mashujaa Day launching this UHC in their all devolved units. What does this mean even for devolution?
In universal healthcare, it's health for all. It does not count whether you are at the national government or the county government. And that is why our engagement is conjoined. We are like conjoined twins. We cannot part. The people, remember, county governments are very much prevalent at the primary health care. They are actually the implementers of what we are doing. We are at the policy level. Our work is to come up with the policies, and then we cascade them down to be implemented at the county level. The activities and the forums have to be done at the county level, the CECs, the directors. Therefore, we are happy to work with the county government, and I am enjoying this. Yes.
Thank you so much. That is the Principal Secretary of Health, that is Mary Muthoni, just giving us an update of the meeting that they've just had with the Council of Governors. I'll be duly informing you in our subsequent bulletins at 7 p.m. and 9 p.m. For now, back to you, Irene Chuma.